As at 8 p.m. last night, we have a further 104 cases, confirmed cases of COVID-19. Just remind you that the day before it was 91 cases. That additional 104 cases brings us to a total in New South Wales of 2,493 cases confirmed. The frontline medical staff have been extremely active with our community, extremely active, and in the last 24 hours there have been 3,540 tests undertaken. That brings us in New South Wales to having 117,633 tests undertaken, which is by far the most of any state or territory. To 8 p.m. last night, sadly, very sadly, we have had 12 people pass away from COVID-19 related illness. I want to express my sympathy to their families and all of the, I think, the community of our state. It is a trying time and a difficult time, and I can't imagine how those families are feeling. Sadly though, there will be more families in that situation in coming weeks. I want to update the community on some orders that I signed last night. As the community would be aware, the National Cabinet, which consists of all of the state and territory leaders, meet and then give directions to state and territory health ministers to translate those directions into orders as best we can under our varying legislation in each state and territory. Here it's under the Public Health Act, and I as Health Minister obviously work with the frontline health staff in public health and the lawyers to try and come up with words that work. And obviously, because it's urgent and pressing that we keep our community safe, there will be from time to time some changes to those orders which are required once we see how it plays out in the community. Amongst the orders that I made last night, with some slight changes to funeral arrangements. Up until last night when I signed the orders, a funeral could have a total of 10 people, which included obviously the funeral staff, perhaps the priest or celebrant, minister. So upon reflection with working with our colleagues in Victoria, who had a slightly different interpretation of the National Cabinet's direction, I've made an order which allows now it to be 10 people in attendance, and that's in addition to those, if you like, those who are officiating and ensuring the service can take place. Also, there were some question marks around caravan parks. I've clarified through the order that caravan parks throughout New South Wales can be used by overnight travellers and by people working in the local area and people whose primary places of residence are temporarily unavailable. And of course we all have very sharp memories of the horror of the bushfires. It seems like a lifetime ago now, but it's not that long ago, and many people are still suffering as a result of losing their homes. So it's important that there be clarity around that issue. There are a variety of other people who also might not have their primary places of residence available, so we've clarified that. Another issue that had caused some anxiety and concern was that our incredible truck drivers who do the long hauls had found it very challenging because the truck stops, those places that they can stay and rest to comply with their work safety requirements, had closed. And we reviewed that situation, and I have no doubt that we need to make sure that our city, our state, functions as best we can, and that people go on having access to all of the supplies we need. We may have, obviously, limits on our movement for our safety, but we also need to be able to access our food, our essential supplies, and other matters that will allow us to live the lives that we'd like to live, but in a more constrained way. So I want to make sure that the truck drivers know now that they can stop at those truck stops, and I want the truck stop operators to make sure they know. It's important the message gets out to them that we, as a government, really want you to open up your truck stops and make sure that those truck drivers, those very valuable people at the front line of supplies, can have their appropriate rest. In the same way, there were some doubts about auctions. Could auctions occur for food supply, for the livestock that will be our food supply, and for fibre or crops? And so I made some orders to make sure that those people who are providing the livestock through auctions and the fibre and crops, and those who ensure that we get food supplies, can attend those auctions. But can I say, in regard to each of those orders, I remind those who will be attending, at whether it's auctions, whether it's caravan parks, whether it's at the funerals, there is still a fundamental requirement that you maintain your social distancing. Maintain it. It's 1.5 metres from any person near you. And inside, it is also that each person must each facility must ensure that they don't get more people in that space than one person per 4 square metres. I know it sounds difficult, but it's actually for your own safety. It's for all of our safety. As I've said before, this virus, this COVID-19, is an extremely dangerous virus, but it isn't a high jumper, it isn't a long jumper. If you keep your distance, you're much more likely to be safe. I also remind each of these facilities that will be open that they must ensure the highest level of cleaning and disinfecting of spaces where people are putting their hands and their arms. From the moment they walk into that door, there should be available hand cleaner, the alcohol-based hand cleaner. They should be asked to clean their hands, and they should be available to use inside the facilities. I think people have largely got that message now, but it needs to be reinforced, and I ask certainly the media to make sure that you do your part to support us in that regard. I also want to thank people. What I've seen and what the health officials are now seeing is, since basically last Saturday week, today week ago, there has been a remarkable taking on of responsibility by all of us. Some very strong messages have had to be sent, particularly the issues around all those people who were on Bondi Beach, well within the 1.5 metres. But the movement of people off that beach has sent a message to all of New South Wales, and indeed I think all of Australia, that social distancing is the crucial aspect of our way of life. You cannot afford to treat this lightly. And I'll ask Dr. Chant in a few minutes. I know some young people think this isn't going to affect them. Well, my message as Health Minister to you is be very aware that this can have extremely deleterious effects. You could possibly die from this. Certainly, people who are over 50 with comorbidities, or that's what the doctors call it, we call it, if we've got some other issue, whether it's diabetes or heart conditions or respiratory conditions, you're in a very dangerous space in terms of this virus. If you're over 70, even without those other conditions, you're in a dangerous space. But young people who think they are not going to be affected, you're wrong. It's quite possible you will be. You won't be perhaps affected to the extent that older people will be, but you could be the unlucky ones who end up in our hospital, in our intensive care units, on ventilators, and the consequences of that may be very, very poor. I've thanked the community for what they're doing. I also want to thank frontline staff and the senior health staff. I want to thank the media generally for the work they have done to recognise the frontline doctors, nurses, allied health staff that are actually putting themselves at risk every day, and more so when we move into the next phases that are coming towards us. There are no words. There are no words. There are no words to thank those staff at the front line, but I just want them to know that from the Minister, their Minister, from the senior health staff and from the community, we're thinking of you, and bless you for the work that you are doing. Thank you so much. I also want to thank all of the senior health staff who are working extraordinary hours to keep people safe by giving direction to our state. The Premier, the Police Commissioner, and I have made the point time and time again that when we stand up and give directions or speak or engage our community, it's off the back of health advice from some of the most expert, the most senior world authorities in public health. We as a community need to thank them for what they do. Today, when I read some of the headlines, I have to say my heart went out to those senior health staff. I have seen senior health staff. All I'll say is I've seen them extremely emotional because of the long hours they worked and because of the challenges that they're facing. And I find it disappointing in the strongest way possible that there can be any suggestion that those people are not doing their best. In general terms, can I just say, this city of ours is the gateway to Australia. In normal times, we pride ourselves on that. We believe that we actually do lead the way in this country, through Sydney and through New South Wales. But part of that is we have more people coming through our airports and more people coming through our ports than any other state or territory. We have more cruise ships that come through the Port of Sydney than any other port in Australia. In the normal course of events, there's about 300 of these cruise ships that come in through the Port of Sydney every year, and sometimes it's more. The very senior health staff that make the assessments on those cruise ships are actually amongst the world's best. There were 4 generally involved in each decision making. 4 very senior health staff. They are specialist physicians, doctors, with extraordinary extra training in public health. We have people in that group who make these decisions who are consulting to the World Health Organization in communicable diseases. When they make decisions that the rest of us, if it were one-on-one with our own doctor, would be very, very happy to have that advice. I would say to all of you in the public, and actually it's not so much I think the public, there are others who are making comments, but I would say to people who are being critical, know that these frontline staff are sometimes working, as Dr. Chant did. She won't want me to say this, but last Saturday she had worked for 32 straight hours before she stood before the media. She hadn't slept. People don't do that unless they have extraordinary commitment to all of us. What I would say to the community and to those who are leaping to criticise is take a step back and realise that we need every one of these people who have worked their hearts out, worked every aspect, every possible thing that they could do to keep us safe, and we should be very temperate and careful in any criticism of those people. We need them at the front line. I think if the average person got some of the criticism that's currently being thrown around, they might say, I'm not doing this job anymore. That's something that we can't afford as a community to have. We need to make sure that we are temperate and supportive of all of these senior staff who are making the most difficult of decisions. I also just want to point out that some of these staff have worked for between 10 and 30 years making these sorts of decisions. They bring to it the world's best expertise. In the case of one very senior person involved in decision making, he has actually made assessments on literally thousands of these ships. Now, cruise ships are always a challenge. They're always a challenge. They can be great fun, but I think anybody who's been on one would know that we have regular outbreaks on cruise ships of issues like gastroenteritis, Legionella, influenza, and we do need the experts to be able to give us the advice on how best to address those issues. I'm going to let Dr. Chant now say some words about some of the other matters that we need to look at, and then obviously I and Dr. Chant would be very happy to take questions. Dr. Chant.
Minister, I might just run through some additional statistics for you. In relation to the 12 deaths, the age range for those deaths was 67 to 95 years. And a salient message, as the Minister said, to younger people is currently we have 41 people in ICU, 23 of those on ventilators, and we actually have 4 people in their 30s. So the age range of people in ICU is from their 30s to their 80s, but there are currently 4 people in their 30s in ICUs. And so the message I would like to convey is that whilst this disease is generally milder in young age groups, because no one in the community has protection or underlying immunity to this new virus, we will expect to see severe consequences for some people in the younger age groups. And so it is important that whilst we have a clear focus on protecting the elderly and those over 65 with chronic health conditions and those over 70, it is very important that we, across all age brackets, heed the advice about the social distancing and other measures. We currently have 251 cases of COVID-19 being treated, and it's pleasing to see that about 50% of these people are being treated in their homes through the Hospital in the Home program. A couple of key messages that I'd like to get around at this point is that as we approach Easter, it's critical that we heed the message around non-essential travel. Please do not go to the rural areas, into the countries, move around for Easter. We are experiencing community transmission of COVID-19, and what we need is some time to really understand that community transmission and respond to it. So we are urging the community to please do not travel in a non-essential way to the country or even move around, as the Premier has asked people to really stay at home, keep your contacts very limited and comply with our advice at this time. Thank you, Minister.
Okay, happy to take questions. Thank you, Dr. Chant, for that. Can I just say that the experts who made the decision, were the best in the world. And the appropriate thing at this point is for the investigation to continue. But I'll make this point too. Each of the staff of the Chief Health Officer that made the decision made it to the best of their ability. And those people are experts in their field.
Each one of you are experts on the boat.
I'm talking. Okay. The health department. No. I'll take you through it because it sounds like you don't actually know how it works. I'll just take you through it. No, it's all right. Thank you for your contribution, and I will answer the question. And actually, if you wouldn't mind showing a reasonable level of courtesy, thank you very much. The assessment process that has been undertaken in regard to all cruise ships since the 14th of February was actually, by New South Wales Health, was a far higher level than what actually was required at any time, even after the changes that came into play on the 6th of March. There was a federal protocol that was prepared on the 3rd of March, and it was operational from the 6th of March. That particular protocol gave discretion to states and territories to make a decision as to whether or not you needed to make any assessment, in fact. But New South Wales Health have advised me that as from the 14th of February, so nearly 3 weeks before the federal protocol came on, that they had stepped up assessments on every single ship entering Sydney Harbour. The way that was done was that the ship was asked for basic information such as its medical log. So you actually had details given to the doctors, specialist doctors, from the ship, entirely standard on our standard, on the standard that was being operated by New South Wales Health. That information was then part of a greater amount of information they sought, so they would look at issues like where was the ship from, where was the ship travelling to, who was on board, what was the makeup of the crew, a whole lot of factors that the Chief Health Officer can give you more details in a moment. But on that basis they made decisions, and the decisions were whether they were at what level of risk. The information that you're talking about is standard information, stock standard, no different to what every ship was required to do. And it still only formed part of the information that was required by the Chief Health Officer's team, highly specialist medical team, to determine it. So, you know what? As to all of the other issues that, sorry Chris, just 2 seconds, all of the other issues that will come into play in that, it's very appropriate that Commissioner Fuller will be able to investigate and look at all those issues and give us the benefit of his outcomes in due course. I will say this also, and one issue hasn't been picked up by the media but has been raised by the Chief Health Officers who are involved in these processes. We'd all remember the Diamond Princess, where people were kept on board a ship, and it was a disastrous outcome. And that operates in the mind of all of the senior health officials across Australia. It's a balancing act like everything else. How long do you keep people on a ship in any situation where you may have or may not have influenza, COVID, whatever it be? So the decision that they took was a decision that was made by medical professionals of the highest calibre, specialist public health doctors, and there were 4. Each of them had experience between 10 and 30 years. One of them has dealt with, as I said earlier, thousands of ships coming through our harbour. So I think you've got to say, and I as Health Minister, the same as the Premier and the same as the Commissioner, we have to rely on the expertise of the health professionals. And from that advice, we can convey it to you. We don't make the decisions. I saw somewhere that someone said, I made the decision on the Ruby Princess. I didn't know anything about the Ruby Princess. I was dealing with all of the other issues that were obviously being dealt with and are being dealt with. Usually I'm here at start work at about 6 or 7 a.m. and finish close to midnight. I had no knowledge until the day after or the day after that when I was advised that there were, I think, 3 positive tests. Anyway, look, I'm actually going to take a question from Chris. I've answered the question. Excuse me. Yeah. Well, I'll come back to you when I've got... You want to answer that?
I want to answer.
Okay, Chris, sorry. Chris, can I allow Dr. Chant, because There's a level of enthusiasm here, so I'll just allow Dr. Chan to say something and then I'll come back to you.
Look, I think it's important that if I could just take you through some of the facts. There was influenza circulating on that cruise ship. And we know that because the point of care test, whilst when a point of care test is negative cannot exclude influenza, when the point of care test is positive, it's pretty accurate that it is flu. So we know that influenza was circulating in that cruise ship, and the majority of patients, or over half of the samples that were collected at the time, showed that the cause of illness was flu. Notwithstanding, it didn't breach the outbreak level of flu because that would have then triggered itself a different response. The 2 passengers that were disembarked from the ship were actually disembarked one was for lower back pain. There was mention that they had an upper respiratory tract infection, and the patient was on oseltamivir, which is a flu medication. The former patient was mentioned that they were, and that the reason for their discharge and disembarkation was for medical imaging assessment due to lower back pain, and it was noted that that was a previous existing issue. The other patient was disembarked, and this was the notes that were given by the cruise ship. I have personally reviewed them, and that indicated that the person had been discharged for cardiac issues, and the doctor had thought it was due to an underlying upper respiratory tract infection or an infective process that had caused the heart issue. And in that case, the note said the patient was improving, and the patient, whilst had tested on the point of care negative for influenza, the notes indicated that the patient had been on oseltamivir, which again is a special medication for flu, and was improving. So whilst I agree that there was an evidence of respiratory viruses circulating, because of the pattern that the testing on the kit, the point of care testing showing flu on it, and the level of activity didn't go across that threshold, which was the 1% threshold, that informed the assessment. As I said as the Minister indicated, a panel of public health doctors do the risk assessment on the ship, and that is the process. Obviously, if there are learnings and insights that we will gather, those will be reflected. But just be clear, there was nothing in the mine transmitted to that group of people that COVID was suspected by the doctor on the ship. And that I note that the police commissioner has been asked to do an investigation of any other communications that might have been floating around that would have changed any information. But all I can say is the information that those health professionals considered.
Sorry, Chris. Sorry, this is not your show, Chris.
Yes, and as I said, the process is, and as per the national protocol and our protocol, is that we do test the retained swabs, and that's how we actually came out. You may not have been at the press conference the next day, but we actually announced that the reason we called the press conference and it had found out that there was COVID-19 is we actually did test those swabs on. And what was interesting is 3 of the 10 swabs were actually COVID positive, which again indicates that there was another respiratory virus circulating on that cruise ship. In addition, if we look at the date of onset of the symptoms of the people on the cruise ship, the vast majority had their symptom onset after departing the cruise ship. In terms of the Minister, can I just assure the public, because I think this is really critical, New South Wales Health had learnt the lessons of the Diamond Princess and had extensive planning underway to actually disembark people and passengers should we suspect COVID-19 on a cruise ship or that be confirmed. We had always planned to ensure self-isolation for people in the Sydney region, safe transport home through use of health share and other modes of transport, and also using hotels for the accommodation of people. If we had have known that COVID was on this ship, or it had have been suspected, we would have chosen that way of disembarkation. Having said that, the people that have acquired the infection, to the best of our ability, acquired it on the cruise ship. Obviously, a couple of people earlier on, with onset dates earlier on, may have acquired it and may from other means, but certainly the later ones acquired it on the cruise ship. And the reason we suspect that this amplified so quickly on the cruise ship is because we know some crew members were actually in the galley area, in the food preparation area, were unwell, and that would have led to a significant risk of transmission and that. So the incubation period for the disease, just to refresh everyone's memory, is 14 days. And so we've been following up new cases and linking it with the to the Ruby Princess for that period, because that reflects the fact that they were infected on that at that time. The issue for health, in terms of the issue that would have been averted, is not the cases that acquired on the ship. And as the Minister said, every period of time those passengers were on the ship, they were actually at risk of more transmission amongst the passengers. Notwithstanding, that was not our approach. If we had have known it, we would have got them as quickly off and as safely off. We have identified cases in people that were in contact, and that was in relation to the fact that people with symptoms did transmit on, and that's in the order of 11. Clearly, we are still waiting a few more days and a period of time, so we fully scope that, and we're also working with our colleagues in other states and territories to be open and transparent about the onward transmission as associated with the way that the cruise ship passengers were disembarked. But the risk period for the cruise ship passengers was on that ship. Can I just say, in relation to a previous episode of the Ruby Princess, because it was assessed as higher risk, we actually did hold that ship until swabs were tested. So to some extent, with that would have, if we had known that, had thought that, if that had been a medium risk ship through the assessment process, then that would have been our action. And to be clear about that, that was the action taken on a previous assessment of the Ruby Princess. We were also reassured that there was COVID-5 tests that were taken in New Zealand on passengers that were COVID negative, and this cruise had gone between New Zealand and Sydney. So that's probably the facts that I just want to outline to the community, but be clear, there was the actions of New South Wales Health on that day and the advice of the public health panel was based on the assessment of that information presented to them. They concluded it was a low risk, took the action and tested the results.